Good morning, everybody, and welcome to the Dr. Chip community on Locals and YouTube. We have an exciting new video to show today, just a clip, about 4 minutes. And we're going to talk about how medicine has changed and how doctors are different. I just got out of my cold shower and I'm ready to go. I'm going to show you a video clip from Jesse Lee Peterson. It's about 4 minutes, and his experience with doctors recently. And it's been my experience, and I believe the experience of many people that I've talked to who have come to me with questions. Once they find out I'm a doctor and they saw their doctor and they were puzzled what to do next. And we're going to sort it out, and I'm going to give you some pointers on how to see a doctor in this era and how to navigate through it and make sure that you're satisfied with your experience. So without further ado, here's the video. Give it 4 minutes and I'll come back on.
Most doctors today are no good. That's male and female doctors are no good. They're like robots. And they put you on this assembly line. They have an assembly line set up, right? And the doctors are like, you go to the doctor, doctor, I have a headache, for an example, right? And instead of the doctor sitting you down to discuss your medical history with you, what brought this on, when did you start noticing a difference? Have you ever, in the good old days when boys were boys and men were men, and this is so true, I'm not making this up. When you went to the doctor, which I rarely did, but when you went to the doctor would sit down with you and they would conversate with you about your medical history and all that, because that's the primary part of the diagnosis, to find out, getting an idea of what's going on and how long and why and when, right? But now they don't do that anymore. They do not do that at doctor's offices or anywhere, as far as I know. Maybe I'll know some people. But when you go in there now, it has an assembly line set up. This is for the blood test. This is for the x-ray. This is for the heart test. This is for EKG. This is for whatever, right? It's like you just go down this assembly line and then you finally end up back to the doctor, excuse me, and the doctors say, oh, either we can't find anything or here's a pill. But they know nothing about you. And then they have a bunch of other people waiting in the office to just bring to this assembly line. It's like the doctors are lazy. I don't think they train the doctors right. I don't think they have taken away the idea of getting to know the potential patient so you can really find out what's wrong with them. I know old-time doctors, but they live in Alabama. They live in other parts of the country. And those doctors have said to me over and over again, too, that doctors today are no good. They don't know anything. They have been not really trained to be doctors. They have been trained to be like robots on an assembly line. They don't even have time to sit and talk to you because they got to make the money. They got to just get you in and out. They ain't got time to play. They don't care about you, really. They do not care about you. They'll read the report of the results of all the tests that were done, and then they'll give you what they think it is, and that's it. Write a prescription if they think you should need one, and that's it. But doctor, can I ask you a question? No. What? and they'll let you ask one fast question, but they'll give you this personality like you are in their way. They don't have time to be chatting about your health. Isn't that amazing? I didn't know that. I had seen glimpses of it, but I saw the real deal this time.
Okay. So I was really struck by this video because it's exactly what I've experienced and what it seems everybody's experienced that's come to me, whether on the soccer field, at halftime, sometimes at work, because I was trained to listen to people. And so even though they saw some other doctor for their problem, they come to me to get somebody to listen to them and help them navigate through what to do next. So let's go through his points. First thing that Jesse Lee Peterson said was doctors are like robots, and he even said later in the video that they're trained that way. And I totally agree. I watch the young doctors pull out their little manual, and if the test shows A, then you do B. And they always look at the test results before they go in and see the patient. In fact, patients are so used to that now that when I see a patient, and the first thing they'll say is, well, what did the MRI show? And I'll say to them, I haven't looked at it yet. I don't want to have any preconceived notions about what's wrong with you. I'd rather do it the way I was taught, which is take a history first. In fact, I was taught that if you take the history long enough, eventually the patient will give you the diagnosis. They'll just hand it to you. But you have to be a good listener. The American Family Practice Association, I think it's the AAFP, they did a survey a few years ago, and they wanted to find out how long it took for a primary care doctor to listen to a patient before they interrupted. And it turned out that the average time was about 18 seconds. When a patient started talking, 18 seconds later, the doctor interrupted. And so I joke with my patients and say, I listen well. I give people 36 seconds, and they all laugh because they think 36 seconds, of course, isn't enough either. And it's not. But modern day medicine is like that. Modern day medicine, I had to take my headset off because I put it on so I could listen, but I don't like to wear it over my head. It's uncomfortable. But doctors don't spend the time to listen anymore. And so how can you make the proper diagnosis? All you can really do is get a test result and treat the test result if you're not taking a good history. The assembly line notion that he mentioned is really true. So he says doctors are trained like robots to work on an assembly line in order to make money. And that really fits for me and my experience. What's going on? I think doctors aren't trained anymore to think for themselves. When I was trained and when I went to medical school, they taught us to think for ourselves. They taught us to take a history and listen and to consider the possibilities and think for ourselves rather than looking at a manual after getting a test result. So things have really changed. Doctors don't think for themselves. They're in it for the money. They're like robots on an assembly line, and we can't change that, but I can help you navigate through it. I do a lot of curbside consults. Curbside meaning people come to me and say, I have this ache or I have this pain or I saw this doctor and what do I do? And doctors today don't like to do that. First of all, they don't really think for themselves. Second of all, they're defensive. They think they might get sued, so they won't even give out advice. They'll just say, you'll have to go to a different doctor or on and on. But I say to people, yeah, I know the system and I'll help you navigate through the system. I'm not going to make a diagnosis for you, but I can certainly tell you whether or not it's worth seeing a doctor or whether or not you probably don't have to see a doctor if you can wait on this one. what the signs are, if it's important to go see a doctor. And because of all the curbside consults I do, and my experience with doctors, I've learned how to navigate the medical system as it exists today, how to navigate to what I need through the assembly line and the robots and the doctors that don't think for themselves anymore. Okay, so I have a few points. The first thing that I would recommend you do when you're going to see a doctor is when you make your appointment, request that you see the doctor. That sounds really odd to me because we didn't have to used to do that, but now there are so many uh, lower level practitioners that they just call going to the doctor, going to a provider. That's what the insurance companies call it now, provider. They're just trying to mask the fact that if you don't ask, you are likely to see a physician's assistant or a nurse practitioner. They do not have the training of a doctor. Uh, after college, a physician assistant gets about 2.5 years of training. After getting their bachelor's degree, I think a nurse practitioner maybe gets 1.5 years, their master's. A doctor typically spends about 7 to 9 years after college learning and training. So ask to see a doctor. They'll typically give you a hard time, as they always do with me. Oh, well, you'll have to wait longer and on and on. And I'll say, fine, I'll wait longer. Whatever. I want to see the doctor. Now, I should say that I don't mind seeing a PA if I just need a note to return to work, something easy. But I don't want to be diagnosed with a problem by a PA if I can see a doctor. I just think that the doctors have more training. So there's a better chance we're going to get the right diagnosis. Okay, that's bullet point 1. The second one, be ready when you go in with what you want them to know. You're not going to get much time. So, have your story organized. When things started, what your symptoms are, what you want out of the visit. Be prepared. If you have to write down your points, write it down, but be prepared before you go in with what you want them to know, what you're going to say. My third one, ask questions. This is very, very important. People don't do well sometimes with what they consider to be an authority figure like a doctor, but I'm a doctor and I really enjoy when people ask me questions. It helps me get to know more about them. And also, sometimes it challenges me and makes me a better doctor because they might come up with a question that I need to look up. In fact, I will go right to the internet if I don't know the answer and say, well, let's look that up on the internet and see if we can find an answer from what I consider to be a reputable source. I'll help you navigate through the internet so you don't have to, because how do you know what website or what journal article is reputable? That's something that I do all the time, so I can help with that. So ask questions as they come up during your visit. You have the right to have all your questions answered, and we must speak up in life or we will suffer. Okay, fourth, before you make a decision, if the doctor recommends that you do something, take a moment to be quiet and consider. Write down what they recommend. Tell them that you need maybe a few minutes out in the waiting room, or maybe you need till tomorrow or the next day to really consider it thoughtfully. When you're not nervous, like you would be in a doctor's office, and maybe agree to something that you wouldn't if you had time to think. So tell them that you need time to consider when they recommend something that you weren't expecting. Lastly, my last point, If you're still not sure after considering the doctor's recommendations, get a second opinion. I had a shoulder problem recently, and I'm an orthopedic surgeon for about 30 years. Oh, I take it back, 35 now. And I know a lot of good orthopedic surgeons, and I knew what was wrong with my shoulder, a slap tear. I'm a shoulder surgeon, so I knew what I wanted to have done. And I got the first opinion, and I don't know, he kind of questioned me and, why do you want to do that? And why don't we repair it? And I explained why. And he just wasn't that interested in the science I had to show him. So I got a second opinion. Now, the second opinion wondered why I wanted to even have it operated on at all. And I could tell he just wasn't comfortable with treating slap tears, which is a type of labral tear. So I got a third opinion. Okay, I'm an experienced orthopedic surgeon, shoulder surgeon who knows this problem, and I still got three opinions. And I'm so glad I did, because the third opinion said to me, Chip, you're 62 years old and your shoulder's inflamed. You've been living with this slap tear for 30 years. Why don't you just get a cortisone shot for the inflammation, and maybe it'll calm down and you won't have to have surgery? And I had time to consider it. And when he came back in, I said, shoot it up. And I haven't had any problem with the shoulder since. It's back the way it was. It doesn't have that severe pain when somebody bumps into me on the soccer field anymore. So the fifth one is always get a second opinion if you're not sure after considering what the doctor recommends. So let's go through those 5 bullet points again. Ask to see a doctor, or you will see a PA or nurse practitioner in modern day medicine. Be ready with what you want them to know, even if you have to write down your bullet points or your story. Third, ask questions as they come up, and make sure you get all your questions answered, even if you have to call back and ask the doctor to call you because you have more questions later. Fourth, take time to consider. Don't make rush decisions, especially when they recommend a procedure that's money-making for them, like surgery. And lastly, after considering and having all your questions answered, if you're still not sure, get a second opinion or a third opinion. Well, I hope this has helped you to navigate through modern day medicine. Don't judge them. They're doing the best they can with what they have to work with. And doctors are very afraid. They have high overheads now with a lot of people underneath them. I remember when I was in private practice and the overhead was about $30,000 a month. And that can be a lot of pressure on doctors to keep seeing the numbers. So don't judge them. They are who they are, but learn to navigate through the system so that you'll be content with your decision and your treatment. So if you have comments, chats, please write them down for me. And welcome again to my new locals community. And I look forward to more videos in the future on health and wellness, including food sourcing, how to eat properly. Do we really need supplements? And on. It's going to be an exciting year next year, 2022. Have a great holiday this Christmas season, and I'll talk to you next time.